everyone, and thank you for connecting to this webinar. I am Gwenaëlle Caillot, Marketing Leader for Ultrasound Lifecycle Solutions for Europe. And today I am with Benjamin Merza, Commercial Quality Specialist from Sweden. We will talk about an essential topic for patients and medical worker safety, hygiene, and especially how to avoid cross-contamination. We will have some questions and answers at the end, so feel free to ask your question in the chat during the session. Hygiene has always been a key topic in medical facilities and now more than ever since the pandemic. And in Europe, the use of ultrasound system is increasing, so the risk of cross-contamination. Benjamin, could you tell us why there is a risk of cross-contamination in the medical environment?
Thank you, Gwen, for your question. Let's start from the left side down. In this image, we can find the three things that are necessary for infections to occur. And this is according to Centers for Disease Control and Prevention. So we can see the source, meaning that these are the places where germs can live, as for example, on the skin of a human or on a medical equipment as ultrasound probes. So patient's skin, where we can find germs, we might find germs, also health worker skins, we might find germs and ultrasound probes. And then we can also find in a hospital environment, we can find the susceptible persons, and these are the ones who are not vaccinated or otherwise immune. Could be patients with reduced immune system with a way for germs to enter the body. So let's say you've just gone through a surgical procedure where your skin is broken, and then you need to do an ultrasound examination. In this way, you might enter germs into the body of the susceptible persons. And then we have transmission. Germs don't move themselves. They depend on people. It could be patients, could be health worker. It could also be a piece of medical equipment, as for example, ultrasound probes. So all these three necessary things for an infection to occur are actually there in a hospital environment. So in general, the spread of infections can occur between people, pieces of equipment, or within the body. These infections can cause serious complications. So if we look across Europe on any given day, you will find 80,000 patients that have at least one healthcare associated infections. Some studies shows us numbers as, for example, 23% of all medical professionals they don't always use probe covers for interventional procedures. We can also find out that 12.9% of probes that are used on hospitals, they still remain contaminated following low-level disinfection, and that up to 9% of covers that are used in hospitals, they lack the high barrier quality which is needed, and they leak. In 2016, in December 2016, there was a survey published by European Society of Radiology. In this survey, you could read things as, for example, that not all medical professionals are using probe covers or sterile gel, even for these procedures that they should actually been using them. We can also find out that ultrasound probes could be a source in a hospital, a source for germs, where germs can live in a hospital environment. And that there was a wide range of ultrasound probe decontamination practices around Europe.
Okay, thanks, Benjamin. I think we see clearly the risk and the importance to take it seriously. Then I would like to ask you, when should we disinfect ultrasound probes?
Before or what will help us to choose the way of disinfecting the probes is knowing how ultrasound probes are classified. There is Spalding classifications for ultrasound probes based on the intended use. So we have critical probes, and these are the probes that comes in contact with sterile gel or blood. And then we have semi-critical probes, and these are the probes that comes in contact with the mucosal membrane or with non-intact skin. And then we have the non-critical probes, and these are the probes that comes in contact only with intact skin. So depending on the use of the probes, you choose the way of disinfection or the level of disinfection which is needed for each specific case. So for non-critical probes, the low-level disinfection is sufficient. For semi-critical probes, we need to go a step further and we need to do a high-level disinfection. And then for critical probe, we need to do sterilization. Just to give an overview, what's the difference between low-level disinfection and high-level disinfection, we can see here that for high-level disinfection, we mean that every disinfection that will kill bacteria, mesobacteria, fungi, virus, and some spores. But for low-level disinfection, we only totally kill bacteria, but no mesobacteria, some fungi, some viruses, and no spores at all. Again, here, just to see how we are classifying the probes and what level of disinfection is needed. So for critical probes, and if you remember, these were the probes that comes in contact with sterile tissue or the blood, as for example, if you will do a biopsy procedure. So these probes must be sterilized. The problem with the probes that is we cannot expose the probe for high temperature as 100 degrees or further. And therefore, we need to do what is recommended, is high-level disinfection and also using sterile probe covers, so we can use the probe for these type of procedures. For semi-critical probes, which were the probes that comes in contact with the membrane, mucous membrane or intact skin, for these probes, we need to do high-level disinfection. And then we have the non-critical probes. For these probes, we need to do a low-level disinfection or high-level disinfection.
Okay, so yeah, there is a very clear classification regarding ultrasound probes. Yeah, that's clear. Can you share with us what ultrasound societies and national health in countries say about probe disinfection?
Sure. The newest recommendations that came out November 2020 from the European Society of Radiology, they come out with 10 golden rules. So the first rule is that the hands of the practitioners, as well as the ultrasound probes, must be cleaned and disinfected between each examination. And that it's not acceptable anymore to simply wipe off ultrasound gel between patients. We need to do the cleaning and the disinfection anyway, since we cannot determine which normal microscopic flora patients may carry. And it's not only the probes we should think about. It should be the probe cable, the keyboard, the touch screen, the ultrasound console, and these parts of the ultrasound system must be frequently fully decontaminated. And then we have the ultrasound gel. The bottle should not be kept open upside down, especially for those ultrasound systems which has a bottle warmer. The use of ultrasound probe covers, dedicated ones, single packed, certified transducer covers, where they should be used, as for example in semi-critical procedures, and that we should have sterile gel inside and outside the probe covers for endocavity examinations and all interventions. Biopsy kits, avoid using reusable biopsy kits and stick to use only single-use biopsy kits. for low-level disinfection is sufficient for non-critical ultrasound probes. For the probes that comes in contact with the non-intact skin, you need to have high-level disinfection for these probes. Automation is recommended, since automation will make sure that you are decontaminating, disinfecting your probes same way, no matter who the operator is. So you are reducing operator-associated errors and variations in this way. Around the world, you will be finding several recommendations and guidelines where high-level disinfection is recommended for semi-critical probes, as well as automation. It's good to have automated systems, and it will make sure that all the error variations associated with the operators would be reduced here. And then you have validation. For some automated systems, it's offered, there is a way offered for the operator, a visual way where you can be sure that the disinfection cycle is being completed and successful. And then you have traceability. It's important, it's starting to be more and more important to know that the probe which you've been examined with has actually been disinfected before it's been used on you as a patient. So some automated systems offer this possibility as well.
Okay, thank you very much, Benjamin. Now that we know more about recommendations and guidelines, I think a very practical question is coming to my mind. How do we disinfect an ultrasound probe?
That's a really good question, since there's a variety of ways how you will disinfect your probes. Before we go through how you will disinfect your probe, I would like to highlight the importance of knowing the difference between cleaning and then disinfecting. So by cleaning, we mean you will take away whatever is seen by your eyes. So you use, for example, enzymatic detergent, you take away the gel, you take away the dust, you take away the particles you can see with your eyes. When that's done, you wait until your probe is dried. When your probe is cleaned and dried, only then you can do the disinfection. If we don't do that, if we don't do the cleaning in a proper way, there is a risk that disinfection will not be done in an effective way because some particles may hide a biohazard beneath and therefore very hard for the disinfection chemicals to take it away. And if we go back to the question, Gwen, you were asking for how to disinfect the probes. Well, again, it depends on the probe you're using. Is it classified as non-critical probe? Then low-level disinfection wipes is more than enough to use. If your probes is classified as semi-critical or critical probes, then you need to do a high-level disinfection. And for high-level disinfection, we have three different ways. We have wipes, which can do the job, and then we have soaking using a different type of chemicals to do this, and then you have automated high-level disinfection solutions, which were actually recommended by the European Society of Radiology to make sure that you are eliminating all the errors associated with the operator. Then the use of automated system is the solution. One important thing to think about when choosing the method or the chemical that you want to use for disinfecting your probes is actually checking out with the manufacturers if this chemical is compatible with the probe and the ultrasound systems you have. We at GE Healthcare, we have a very good webpage, useful one, and a very easy to use. You can find the model of the probe you have or the console, and then you will get the list of all the chemicals, all the systems that are compatible for using for your probe or the console. In this way, you will make sure that you are prolonging the life cycle of your ultrasound system and ultrasound probes.
Thank you, Benjamin. Thank you for this information. I think this is really important that during this pandemic, we make sure we are all aware about the proper recommendation when it comes to hygiene. Any takeaways that you would like the audience to leave with about that presentation?
I have 4 takeaways to take away for the audience. The first one is knowing the difference between cleaning and disinfection, knowing the importance of performing a well done cleaning of the probe and then doing the disinfection, and that it must be done between each examination. So again, it's not acceptable to only wipe off the gel and think everything is fine. So we need to do cleaning in a proper way and then the disinfection in a proper way. And then that for semi-critical and critical probes, then high-level disinfection is required. And keep in mind that the European Society of Radiology is recommending the use of automated system to make sure that you are eliminating all the error, the variations that could be associated with the operator. The third takeaway could be that cleaning and disinfection must be done between each examination. The fourth one is the compatibility of the chemical you're using for disinfecting the probes. Make sure it's compatible with the probes, it's compatible with the console. And we can do that. We at G Healthcare, we are providing our customer with the web page where they can check for their probe model and then get the list of all the chemicals that are compatible with the probe and the console.
Super, thank you. We will be able to answer questions in a minute, but before that, let me tell you that if you need any further information about probe care, we are running customized webinars for you. Benjamin, maybe you can share a bit about your experience in the Nordic.
Absolutely. Customized webinars were an initiative that came during COVID-19 periods. We wanted a way to reach out to our customer to help them with the hygiene routines they have, to help them simply to take care of the probes in a proper way and to prolong the life cycle of their probe and ultrasound consoles. So we were in contact with different departments around Sweden, around Nordics, and we listened to our customers. We asked them questions. What do they need? How are they performing the disinfection and the cleaning of their probes? And then we build up a webinar together with the customer, and we go live to everyone who is working at that specific department. And then we went through step by step how you clean your probes, where you should focus on. We gave them simple tricks how they can do a visual inspection of the probes, and in that way identifying if a probe is functioning well or not, and just to help our customer during these tough times, to really clean and disinfect the probes, and to how to handle their probes. So I really recommend this for customers around Europe, around the world. In Nordics, we had at least 600 attendees during 2020, and they appreciated the webinars very well.
Yes, super. Thank you, Benjamin. So really feel free if you have any question, any further information that you are looking for about probe care, and we can organize that. We have as well hygiene solutions, so feel free to contact us as well for that topic. Thank you.
Thank you, Gwen.